Hello everyone. Today we will talk something about atrioventricular block. This is very common bradycardia. Atrioventricular node is the only way the pulse goes through the atrial part to the ventricle part, the only way. For atrioventricular node, function is abnormal. The patient maybe catch very severe bradycardia. They have three types: the first degree, second degree, and the third degree. Let's see something about first degree AV blocker. AV block. The PR interval usually is shorter than 0.2 seconds. If the PR interval is longer than 0.2 seconds, we call them AV blocker. The first degree AV block. In 2016, the new guideline for pacemaker identified the PR interval may be longer than 0.3 seconds. If the patient has symptoms, this kind of patient may be implanted with a pacemaker, two-chamber pacemaker. We can see this one. The PR interval is prolonged. This one is very severe. The second degree is classified the two kind: Morbis type 1, Morbis type 2. For second degree AV block, usually the patient only have the P wave, no QRS wave. Maybe irregular or regular. This is Morbis type 1 block. We can see the PR interval is prolonged. This first, second, third, the fourth, the P wave is not followed by QRS wave. This one is total block. This phenomenon may be in some normal patients when they are in sleeping. They have some symptoms, but this one we needn't treat them. This kind of patient, they needn't to be treated. Clinically, patient with Morbis type 1 block usually without symptom. Usually when this phenomenon appear when they are sleeping. But for some patients, this phenomenon appear in days. This patient maybe have some symptoms. This kind of patient, maybe we talk them to care about the ECG, to repetitively to take Holter ECG every 6 months, to just observation continuously for doctor to this patient. Common cause for Morbis type 1 just include some drugs, acute malinfarction. Sometimes the patient may be normal variant. They are healthy. They have no diseases. Usually see this kind of person in younger male or female person. Morbis 2 is a severe phenomenon, severe disease. Type 1 is not a disease. Type 2 is severe. If we see the patient have type 2 block, we will talk the patient you must be implanted pacemaker. For type 2, they are very different. For this one, we can see the P wave and the QRS wave and only P wave cannot conduct to ventricular part. So the QRS complex disappeared. For this one, it's normal. The PR interval may be normal, may be prolonged. Then the next two P wave cannot conducted to the ventricular part. Then the patient rhythm is very irregular. They maybe have long heart arrest. Only P wave, the atrial movement activity can't supply blood to all around our body. The QRS wave means ventricular activity can supply blood to all over our body. So only P wave is no use. Let's see the third degree AV block. It means totally AV block. Third degree means totally. Atrial activity have no relationship to the ventricular activity. The PP interval is different from the RR interval. Completely blocked. Completely different. This one is also, the patient has atrial fibrillation. The atrial part is fibrillation. The ventricular part is escape rhythm. The ventricle escape rhythm. The ventricle for the patient without AV block, for atrial fibrillation patient, the RR interval is also irregular. For atrial fibrillation patient, the RR interval is regular. It means the patient catch third degree AV block. The QRS has no relationship with atrial activity. For the third degree AV block, maybe have some reasons, or maybe haven't any reasons. Maybe the patient have a malinfarction or myocarditis, but it's not common. For most common patient is they have no clearly reasons. Third degree AV block is very severe, life-threatening arrhythmia. If the ventricular rate is very low, the patient can only lie down on the bed. They can't do any movement. They also may be unconsciousness. This one we must do some emergency operation to be implanted temporary or permanent pacemaker. Treatment of AV block for most of people, we just take the disease history and to ask people have taken any medicine or take some test for the blood and to know the patient maybe have electrolyte disorder. and remove them. For the patient have no reasons for the first degree AV block, we needn't to treat. For the Morbis type 1 block, maybe the heart rate is not too low. This patient needn't any treatment. For the heart rate is very low, we may to give patient some drugs. We use atropine or isoproterenol to intravenous. For the malinfarction, acute malinfarction, we can't do this. Can't give patient this one. We give patient atropine. For the type 2 block and 3 degree AV block, we usually to give patient pacemaking device implanted. For emergency patient, maybe we usually do temporarily for malinfarction, for myocarditis. For this kind of patient, maybe totally recovered from the AV block. For the patient have no reason, they haven't taken any drugs or haven't taken AMI. The patient feel faint, feel very uncomfortable. This patient you can't take any history. They have take some drugs or have other diseases. The heart rate is very low. We just give the patient a permanent pacemaker. Thank you, everyone.